Hi everyone, my name is Toni Lee and I'm a second year professional master's student at the University of South Carolina. And today I'm going to be demonstrating to you guys how to do different variations of cervical manipulations and distractions. So the first technique we're going to do is a cervical manipulation. So first I'm going to have my patient laying prone with their face on the table, and I'm going to find C2 and C3 where they can join. And I'm going to take my thumbs. So I find C2 and C3. And basically what I'm doing is I'm pushing a posterior anterior pressure on one side of the joint and then just alternating to do the other side of the joint. So I'm going to start that here, moving on the right side, and then on the left side. Then another technique you can do is you can have the patient rotate their head to one side. If you want to rotate your head to one side for me. So she rotated it to the right. So what I'm going to do, if you want to come a little closer, I'm going to take my right thumb, again at that C2, C3, and I'm just pushing at the right side of the neck. So I'm basically pushing that same pressure on the same side that she rotated on. And then if you want to rotate to the opposite side, we can show it this way. Yep, so again, C2, C3, and pushing on the same side of rotation. All right, so then the last technique we have is a cervical distraction technique. So they are going to be supine on the table and they're just going to rest their full body weight of their head into your hands. You're going to take your hands and cup around the occiput and a little bit around that mastoid process, and you're just going to provide a gentle distracting force to feel a stretch in that joint space. And another way you can do this, again, you can grab one hand in the base of the occiput and one underneath the chin. And you're going to, again, provide that slight pressure. And then the last technique for this is you can grab a towel. In this case, I have a sweatshirt, but if you just want to hold your neck up for me real quick, thank you. You're going to fold that towel or sweatshirt underneath their occiput. You're going to relax. And this will give you a little bit more leverage to be able to pull them. There we go. To be able to distract them appropriately. And that's cervical distraction.